thank you very much. Thank you very much. Thank you very much. Once again, it's the Weekend Health Talk Show, and I am your host. I'm humbled to be your host, Dr. Albert Sedohian. I do this weekly to help reduce the level of misinformation out there, especially on social media when it comes to medical issues. A lot of people share their thoughts and their opinions on issues that they don't have any reason to be sharing because they are not expertise in such fields. So I decided to contribute my little way of hosting specialist medical doctors to on topical issues every Saturday, Ghanaian time 4:30, and of course East African time 7:30 p.m., Nigerian time 5:30 p.m. So we can hear from them and have an opportunity to have a free specialist consultation talking about asking them questions freely. All right. So today we are blessed to have one of such finest specialist doctors from the topmost and the premier hospital in Ghana, Kolebu Teaching Hospital. We have Dr. Michael Kwapon. He is a specialist surgeon and he's going to talk to us about typhoid. What is it? What is it not? How do we go about it? So please join me, welcome my brother, my friend, colleague, Dr. Michael Kwapon to take us through the topic. Very controversial with a lot of things to learn about. So over to you, bro.
All right. Thank you very much. Thank you very much, Dr. Albert. And I'd like to say thank you to everybody for coming around to listen to this today. If you can hear me, just type a Y. You can hear me, type a Y. You can hear me, type a Y. Just so that I know that I'm not talking to myself. The more Ys I see, the more I know a lot of people can hear me. Can you hear me? Good. Now I know I'm very audible. So that's a good thing. So thank you, Dr. Albert, for the opportunity again. And thank you to everybody who also is on this call, whether by YouTube or by the Zoom link. You're all very welcome. And hopefully you're all going to come away with good knowledge about whatever this typhoid thing is. Okay, so whilst we are still getting on, let's just invite a few friends. You probably know somebody who has always been complaining, well, every day I have typhoid, I go to the hospital, it never gets cured. I mean, all those people, get them on the call, tell them there's something going on, they stand to benefit, they can learn a few things from. So we all learn something very good about this thing. All right, so my name is Dr. Michael Kwapon. I work with the Kolebu Teaching Hospital Department of surgery, and today we'll be talking about the typhoid fever. I'm sure everybody knows, especially if you're in sub-Saharan Africa, you know what typhoid really is, or even if you don't know what it is, you've heard it being talked about quite a number of times. Oh, he has typhoid. He goes to the hospital, he gets treated for this, and then it's not working. Or maybe he should be treated for typhoid. What is typhoid? Is it something that you get after you've gotten one illness, like you get malaria and then it changes into typhoid? Or what really is it? And today we are going to talk about it. But before we talk about the subject proper, this is how we are going to look at it. All right, we look for how you behave when you get the typhoid infection, and whether it can be treated or whether it can be prevented, and what you can do to help yourself get better. All right. So I'll just share a simple story about somebody called Mary. You can call her Madam Mary, Auntie Mary, whatever Mary you want to call her. She was born in the 1800s, 1869 to be precise. Now this woman was Irish and she emigrated to the United States. All she was doing was she was working, helping households, like as a cook or as a domestic help, as it were. And over the period, she used to work with her employers. They realized that people were getting sick. Now, typhoid at the time, just know that science was still developing. We hadn't had antibiotics for a lot of things, typhoid inclusive. So then people who came into contact with her or who ate anything she prepared, and most of the time they came down with this very this very illness. And because at the time there wasn't any treatment, quite a number of people, a few of them unfortunately passed on. And it became something of public health concern, especially in the United States. All right. So over the period, I mean, as time went on and as these cases were investigated, they realized it was linked to this particular woman, Mary. And they realized anything that she cooked, I mean, anybody who ate from whatever she did, most of the time came down with typhoid. So then she was nicknamed Typhoid Mary. All right. And you get to see what it means to be a typhoid carrier and why Mary, she was virtually almost all the time healthy. But then any other people who came into contact with the typhoid germ, they became very sick, and then some of them even lost their lives. All right. So this is Typhoid Mary, the woman who has given us some history about the about typhoid fever. All right. So now, typhoid fever, what really is it? Now, just know that, I mean, those things that we have highlighted in bold, those are the names of the germs that cause the illness. So these are Salmonella typhi and then Salmonella paratyphi. All right, these are big names. You probably don't need to memorize all these names, but if you want to sound some way, you can just learn them. These are the things that cause Salmonella typhoid fever or enteric fever. Now, just so you know, it is not when you have malaria and it doesn't go, then you get typhoid. It's a whole disease on its own. It's a whole condition on its own. And it is not malaria medicine that would cure typhoid. Neither is it typhoid medicine that will cure malaria. They are two separate entities, okay? And usually, this is a kind of fever that comes along with abdominal pains or belly pains, and then you almost always you feel cold, like you are sick. So one of the things that confuse a lot of people is the symptoms with malaria or any of these tropical illnesses, they usually overlap. So then you think it's malaria, and all you'll be doing will be treating malaria. And I mean, for the most part of the time, once you have malaria and then you treat it, you shouldn't have it again in a very short period of time. All right. I mean, if you treat it and you treat it very well, it should be something that should go, really, and you should feel better. But then, because the first point of call is malaria, we treat malaria, and then if it's not working, then it's probably typhoid. Well, probably so, or maybe something else altogether. But just know that it is something that is also an entity on its own, and it's pretty much common in our sub-region, sub-Saharan Africa, especially in places that have poor sanitation and places that are overcrowded. So then you have, because of the poor sanitation and overcrowding, you have refuse dumped anywhere, people not having proper places of convenience. So then you have effluent from these places spewing into water bodies and other things. And then you see it more common in children and young adults. Young adults, okay, children, because they like to play outside. They play outside, they play on the floor, on the ground, they come back home and they don't wash their hands before they eat. Young adults, especially the male, my gender, especially the males, I mean, always adventurous, always outside, eating anything from outside. Older men, women, they almost always have home cooked meals. So then they sort of do not come down with this condition as often as the younger adults who are always on the move, who need to buy food on the streets because they are always on the move. All right. And it's been seen not only in Africa, but anywhere the sun shines. All right. So especially these tropical areas, South Central, Southeast Asia, Latin America, Caribbean, and of course, Africa. All of these places, it's very common there. But then you don't see it as much in the West or in Europe. You don't see it as much in the US or in Canada or in Europe. If anybody over there gets it, they probably would have traveled to somewhere, an endemic area like this place I mentioned earlier. And then they will pick it up and then take it to their home country. Usually that's how it is. because I mean, of course, you can look at how their infrastructure and their sanitation is. It just works to separate all these effluents from 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 food or water. Now, this is what we mean. We all look at the picture now. I just want to know if you can see what I'm seeing. Can anybody? I mean, anybody just type in what you can see. Yeah, I have 4 pictures on my slides. Just type anything that you can see. I just want to know if you see what I see. There's one of them that strikes me very hard. Just type what you can see. I want to know. Just type, just so that we all know that we are all together in this presentation. Just type something. What can you see in this slide? What can you see? 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 What can you see in the picture? All right, open defecation. You can see a dumping site, yes. And for me, that's nice. I mean, that's what it is. You can see dirt around. See the man in the top right corner. I don't know what it is he's doing in that thing. You can see that there's water, there's rubbish, and then he's looking at whether he's hiding from someone or from something. I'm not sure what it is. Now, the whole thing about typhoid is these are the things that bring it about, or these are, I mean, they're in the environment plenty. But how do you get it into your body? How do you get it into your body? Either we get to find out. We get to find out. So let's just take a look. You see, there's water in the bottom left corner. Yes, hopefully, water we use in the house, water we use for whatever purposes, should be potable. All right, it should be free of all these germs. Should be properly treated so that we don't have any concern about these disease-causing organisms. All right. So the question is, how do you get it and how does it spread? Usually, it's from food and drink. Basically, these are the ways you can get it from food and drink. I remember when COVID came around, when COVID started, the whole idea of washing your hands was jammed into our heads. Now it looks like a lot of over the past 2-3 years, it came COVID-19 and we're in 2020. Yeah, so I mean, as time went by, this thing about hand washing started dying down little by little because we sort of started having an upper hand over COVID. But hand washing is one of the things that brought down a lot of these illnesses, typhoid, cholera, especially, because we are all washing our hands. I mean, you take something from somebody, you wash your hands. You do this, you wash your hands. You visit the washroom, you wash your hand. Before you touch your food, you wash your hand. And it wasn't only washing away the viruses off your hands, you're also washing all these germs off your hands. So it doesn't matter whether somebody visited the washroom and didn't wash their hands. Just because you wash your hands, I mean, you are safe. And then anything that you touched and put into your body was essentially better off. Now, you can get it because somebody who probably has it is handling food and the person has shed it. Maybe the person went to the washroom and washed their hands, but probably didn't use soap and then is handling your food. So then you have the bug in the food and then you eat it. And then also people who do not use potable water, most of the time, and thankfully now, most of the water that we have in our taps, I don't know about the situation in other countries, but here in Ghana, quite a number of places get potable water. They are treated, and those who don't have these treated water, they sink boreholes way deep down the water table so that they can get some clean supply of water. Now, what happens with some of these water bodies is that, especially in urban and peri-urban areas, some of the pipes that bring the water to our homes, they're in the ground, and some are rather superficial. So any kind of erosion, then these pipes are laid bare. And if there's any truck or any car passing over it there, these pipes break. Now you have gutters, and in these rains, you have things spewing over from gutters and then passing over all these pipes that are carrying our water. Now, when you have these things, people throw a lot of things in the gutters, excrement, rubbish, home waste, and everything. They put all these things in the gutters, and then these gutters overrun their borders, and then find their way into our water system. So then you think it is potable water you are drinking, but just so you know, at some point in the line, it got broken, and then some of these things came into your water, and you probably won't see these things with your naked eyes. So then they are just multiplying in your water, and use it for your food. Maybe you bought some vegetables and you cleaned it, and you use this water to wash it. The vegetable probably itself may be clean, or probably even the water used to water the vegetables were not all that clean. So then you are just carrying all these things. And then there are those who are known as the chronic carriers. They usually may not be overly sick, but then for some reason, they always harbor the germs that cause the typhoid fever. Now, these people, most of the time, they have things in their gallbladder. Now, that thing is what stores bile, and bile is what gives your stool the characteristic color. It gives your urine the yellowish color. It also helps you absorb and digest fats and oils properly. Now, when the germ gets into your stomach, one of the places it can stay is when you have these gallstones inside, and that's what Typhoid Mary had. She had quite a number of stones, and then these germs found it as a very good place to live and then multiply. So then every now and then they'll be shedding it in their stool. Every now and then they'll be shedding it, and it becomes a problem or a thing of concern, especially for people who handle food a lot of other people eat. Now, not that alone. Before anybody gets sick, it's always an interplay between whatever is causing the illness, and then the person himself, his ability to withstand the disease. Age is one thing. The older you get, I mean, when you start off very young, you're not as immune competent as an adult is. And then as you grow much older, the immunity also begins to drop, all right? So those are the extremes of age. Usually, there are people who are at increased risk. And then gastric acidity. Anybody who just abuses or who takes these medicines that reduce your stomach acid, they stand at an increased risk, not just for typhoid, but also even for tuberculosis. God in his own wisdom produced the acid, and it has its purpose. Really, if for whatever reason your stomach lining or your intestines can't handle the gastric acid output or your stomach acid output, it's important you see a doctor so that it's checked for you, because it also has implications in helping you fight off some of these germs. The acid also kills the germs. And of course, your immune status, how immunocompetent are you? How strong are you? How capable are you to withstand infections or to withstand diseases? It's very important. And there are a lot of things people do to try and help them have an improved immune function. Towards the end, we'll talk about a few of these things, all right? And it's important. It's one of the things that you can actually do something about. Age, you probably may not do anything. You probably just can't do much about your chronological age. As you sleep and wake up, I mean, the days come by, and you grow, really. Gastric acidity, you can alter it here and there. But then again, you still produce it anyway. And then immunological status, things that you can do, things that are simple, things that are everyday things that you can do to just get better, not just because of typhoid, but because of your overall health. It's important. So then let's just have in mind that it's not just the germ itself, but also your own immune status can help you fight off some of these infections, all right? Now, these are things that we like. Now, how many of us like waakye? Waakye is one of my favorite things, all right? I mean, you can't just go on and then not taste waakye. Let me know in the comment section. If there's anybody who doesn't like waakye, let me know. If there's anybody who also likes waakye. I mean, waakye is I think it's one of the wonders of the world, really. Just like gobe. You know gobe is beans. And wache is one of the meals that has gobe featuring in there. It has beans in there, and it's a very nutritious meal because you have rice, you have beans, and then depending on where you come from, what you want, there are other things that are added, the meat, fish, all kinds of wildlife, avocado, salad, I mean, everything. And because of the things that are used for these things. Now, the picture to the left, you see that somebody is growing vegetables. Some vegetables are very good. They are very healthy, especially the green leafy ones. They contain loads of antioxidants. They have good amounts of fiber, and they help your body fight off a lot of things, especially even cancer, really, because of the things they do to your body, the fiber content and then the antioxidant content. Now, you achieve the best effect if they are eating raw, all right? Then you're not destroying many of the vitamins in these vegetables. Now, the problem comes with how these things are grown. If you are looking for, you see where this particular one is grown. If it rains, like it's raining these days, and then this gutter overflows its banks, fair enough. It's just likely that some of the water in the gutter will get onto the leaves of some of these things. And not many people have patience to thoroughly clean these vegetables, especially food vendors. Some are absolutely amazing. Others to just they just don't take their time with these vegetables. So far as it's a vegetable, then that's it. So then the whole advice is just be careful. I mean, eat and eat well, but just be careful where you get your vegetables. And once you get your vegetables, if you are going to prepare it yourself, I mean, clean it and clean it very well, really. If it's with vinegar, you're cleaning it. If it's with salt, whatever, just make sure that it's clean enough so that you have the full benefits of the the vegetable you are eating. And wache it's a very good meal. Now, when I was growing up, one of the things that I used to hear, if you're going to get very good wache, I mean, it has to fulfill some requirements. It had to be either sold by by the public toilet or by a gutter. I mean, these things. I mean, that's where you get some of the best wache. I mean, the best tasting wache. But then it's important that you just pay attention to some of these things, because these are areas that you get your food contaminated by the flies that are on the refuse dump or by the flies that are coming from the public toilet or the gutter. So it's very, very important. Even as you want good food, choose good places to get your good food. And once people get the typhoid, the symptoms, it takes about 5 days, even up to about 20 days to show symptoms. Once the germ comes into your body, it takes about that long, even that short to get symptoms. And the symptoms, like I said earlier, mimic those of malaria. And they can be very, very severe, especially if they get complicated, or especially if you are not able to fight it off very well, contain it very well. You can even have complications that may have to become surgical emergencies. Usually, most people have an increase in their temperatures. They have fever, all right? Most people have fever, and then they start complaining about belly pains. Now, this belly pain can be very severe, especially when the disease has gone on for about 2 or 3 weeks without any proper treatment. Then the intestine can perforate because of how the germ behaves inside the body. And when that happens, it can be very fatal for especially those in the extremes of age and those with very low immunity, especially if you don't come to the hospital very early. They usually feel cold. And then sometimes people have these rashes. They are more like pinkish rashes on the body, the torso, so your chest, your abdomen. Usually you see it better in fat people. Others do have blood in their stools. Now, blood in your stools can be anything, but in the setting of this fever and then abdominal pain, and then you are feeling cold with your body pains, maybe it could be typhoid. And others too may have running tummy or even constipation. And because it's a germ that is in the blood, it affects a whole lot of other organs. It can affect your heart, it can affect your your lungs, even the bones, and gives you a lot of other complications. Now, I'm sure you've all heard about high fever, high fever, high fever. Yes, because the germ can get into your brain or cause things in your brain, altered consciousness, disordered sleep, and confusion with all this fever. I mean, then people we start saying that, oh, this person has high fever or whatnot. In our medical parlance, we call it typhoid encephalopathy. All right. So, just so you know, or by way of education, these are some of the things that can point your mind to the fact that somebody may be coming down with typhoid, and it's important that you seek medical attention. All right. It's important because a lot of people mistakenly treat malaria because these things, malaria, you have fever, you have abdominal pains, you have body pains, you'll be feeling cold. And I mean, depending on what it is, your urine can get dark and you may have difficulty in breathing, altered consciousness, all these things you can have in malaria. And what happens is because you are treating malaria, when it is not malaria, you take about a week or two. So then these things, you tend to come down with the complications more because you are not treating it properly and early. So it's important once you start feeling these things, and then you're not sure whether your food sources or your water sources are usually improved, then it's important you seek medical attention because it's something that can get tested. And once you can get tested, it means you can identify its present and then you can treat it. And most of the time, the diagnosis relies in isolating the germ, and you can get the germ in the blood or in the stool or the urine. We have some rapid tests, the without test, you get to the hospital, it can get done for you, or you can have rapid antibody test. But the most sensitive of them is the test. I mean, the ones that they culture, the blood, the stool, the blood and the stool test, really. Those ones give you better results. Those of us in endemic areas, like in these areas, you probably may have been exposed to it. So you may be expressing things in your blood that may be positive, even though you are not actively carrying the germ. So then when you do some of these serological tests, it may be positive, but you probably may not even have an active disease. It's just because you have been exposed before, and then you have antibodies or substances in your blood that show that, oh, this person has had it before. So it's important if you are suspecting that you have typhoid, just visit the nearby hospital and then you can get tested and then you can get properly evaluated. All right. Now you want to know, once I have typhoid, is it something that will always live with me, or it's I can get cured from it? Yes, treatment is available, and up until when antibiotics were discovered, most people, quite a number of them died. It was very fatal. Now the fatality is given more to people who have complications of the illness, and by that I mean those who have frank intestinal bleeds or those who have perforations and do not present to the hospital in time. Even with those, they still live if they present early and then are optimized for treatment. So then there are certain antibiotics that treat typhoid. It's not every kind of antibiotic that will treat typhoid. So you can't just go to the pharmacy and say that, oh, you want amoxicillin or you want this because you have typhoid. No, it will just be abuse of the antibiotics because it's not every kind of antibiotic that treats typhoid. But then antibiotics are very helpful, and they are special ones, and it may be prescribed for you for about a week or even up to 2, depending on how well you respond to the treatment. And like I said, the complications are also there. They can also be treated, especially if they are recognized early and then if they are reported early. These are all things that are important. But for me, it's important that you don't even get it in the first place, because once you are sick, a lot of things go down. Your productivity goes down. Your own drive to get ahead in life. Everything. I mean, everything it's at a standstill, and doesn't only affect you. The cost of treatment, the people around you, they have to stop working so that they help you. I mean, all of these things. Well, fine. Some like the attention, but it just makes sense to prevent it better than to get it and then cure it. All right. So what can you do so that you can stay safe? For those traveling to endemic areas, or for those in whose home country you don't have these things, get a vaccine before you travel. It can come as a shot or it can come as some pills. Um, it just to protect you. It doesn't mean you won't get it. You probably may get it, but um, you'll be safe. By and large, you'll be safe. All right, and you can handle the germ proper. It can't be overemphasized. Be careful what you eat and drink. Know where you are drinking from. Know what you are eating and where you are eating from. Washing your hands with soap and water has never been so important. It is very, very important. They say charity begins at home. We practice with our family. We go outside. We continue it, and that's how it is. Wash your hands with soap and water before eating or handling food. Drink safe water. Safe water. You don't know where this water is coming from, so be careful where you drink your water from, whether it's from a tap or what. I mean, your best bet is if it's a bottled water. Even that, the FDA has even shown that some of these bottled water, some of them have a lot of these coliforms in there. So some of these things causing diarrhea, these diarrheal diseases, and typhoid won't be far away from those things. If you're not sure what it is you are drinking, I mean, or the source of your water, especially in these rainy periods that gutters overflow and then contaminate our water bodies. Um, it just makes sense to boil your water. Boiling will kill all the germs in your water. At least, if not everything, most of these disease-causing germs will die. And once you boil your water and you're safe, you can just sieve it and then drink. And then don't get ice drinks or flavored ice or popsicles, not because those things are bad in themselves, but because they are water-based things, especially for the same reason as not knowing where the water is coming from. I mean, if you are sure about it, why not? I mean, the weather is hot, you can drink your cold drink. You don't get typhoid just because you are drinking something cold. It's because the water is contaminated, and they'll live better in temperatures that are not overly hot. So just be advised. And then eat food that has been completely cooked and is still hot. So you can still get your wache, but make sure it's hot. All right. Get your wache, make sure it's hot. Get your vegetables and wash them very well. If you want to do it yourself, I mean, it's all the better. And treat it very well, because you are the only place that you have to live in. And if you don't take care of it, who else is going to do it for you? If you are eating fruits, eat those that you can peel yourself or you can wash. If it has peels and then you want it, I mean, you can still wash it with some amount of liquid soap. You can wash all these things very well and wash them very clean. Your raw vegetables and your salad. I mean, be careful and then clean them very well so that you don't have some of these things getting into your system. And be careful which street vendor you buy from. All right, just be careful which street vendor you buy from. Not everybody cooks with improved water, or they cook from places that separate human waste or human excrement from water bodies. You never know, so just be careful. And whilst you are buying the food, make sure the food is always hot, because it's not just typhoid. There's cholera and other forms of dysentery and other forms of diarrheal diseases that can affect you. All right. So it's important. It's important you get strong. It's important you prevent it. It's important you stay strong, not just for yourself, but for everybody around, even for your workplace, because when you're not strong, you're not as productive as you ought to be. All right. So we are coming to the end of this presentation. What can you do? Always level up. Get your immunity up. I can't overemphasize this. Eat well. Get active. Now, for me, getting your immunity up means a lot of things, and these are very simple things. Getting active, eating well, doing the things that you are supposed to do. All right, washing your hands properly. I mean, eating the right kinds of things. And then, I mean, there are other people, or well, for me, I like things that will help me boost my immunity. Okay, so then I have a few things that I readily recommend for people who are seeking ways to improve their immunity, and I'll share a few with you shortly. It's important. Our bodies have ways of trying to protect us, and then if you do not take care of them, I mean, you succumb to a lot of things, either these infective things or even some of the non-communicable diseases like the hypertension and then the stroke. And it's all because you probably are ignoring a few things that you should just be mindful of. All right. So it's very, very important. A lot of toxins are around us. I mean, the food we eat, the water we drink, the air we breathe, all these things come into our bodies, and then they bring down our immunity. But then it's up to us to find ways and means to always be on top of our game, always be up there, so that even if we come into contact with these things, our bodies will have a fighting chance, so that we don't get knocked down by these things. All right. And for me, these two things, they have a lot of extracts. Now, there's longevity. Now, what I like to tell you is that these things are not for the treatment of typhoid or any disease. All right. I recommend these things for people who want to improve their immunity, and for anybody who is recovering from any illness, because they contain things that organic extracts, really. So you have milk thistle, curcumin, a whole lot of things, and they help your body optimize your own master antioxidant called glutathione, and this helps you improve your own level of immunity, your own level of energy. And that's what max ATP and max longevity will do for you. It's all about improving your immune system, so that you have a fighting chance for these things. And even when you're recovering from any other kind of illness, you have a strength, and then you recover much, much quicker. Now, I'll just pause here, and then anybody who has any questions, you can ask. Dr. Albert, with your permission, anybody who has any question, you can.
Thank you very much, Dr. Michael, for such an in-depth explanation into what typhoid is and what typhoid is not. Just to, as an input, Dr. Michael made it clear, be careful which street vendor you buy from. Now ask yourself, those street vendors with babies carrying on their back, when they change the diapers, what do they do? Do they wash their hands with water and soap? Is their hands clean? So when they dish out the food to you or whatever it is, you may not know what that is. So yes, again, let's be careful where we eat and how we eat. Thank you very much, Dr. Michael. If you have any questions at this point, I just want to remind you that this is a weekly program. Over the past few weeks, we've had specialists talking to us about infertility in both men and women. We've had talks on erection, premature ejaculation, prostate enlargement. We've had talks on liposuction, on nutrition, on common medical conditions. So those of us who may not have subscribed to the channel on YouTube yet, I have just shared the link in the YouTube, in the comment section on Zoom. Feel free to subscribe to the YouTube channel so that you get more content of the previous ones and the subsequent ones, as well as this one. If you join us late, feel free to be loaded back onto the YouTube channel in the next few minutes. All right, so at this point, if you have any question, please feel free, put in the chat box, and Dr. Michael will gladly answer you. Please, we have a few minutes. First question is saying, what can one do if a family member already has typhoid?
All right, yes. Before that, I think Mr. Bakchiriga also asked the question that he sees insects in beans and the effects of those insects found in cooked beans. I think they'll give you protein, a lot of the protein. They'll increase the protein. So, I mean, those insects are weevils. And once they are properly cooked, so now it's important that during the sorting, you sort them out if you don't like weevils. But if you don't mind weevils in your meal, why not? You can cook them and cook them very well and eat. I don't know about any illness the weevils give. Even people eat cockroaches, who knows? So you get a good amount of protein if you have these things. But if you don't like it, just sort your beans out properly, and then you cook them. And then what can your family do what can you do if a family member has it? So it's not a life sentence, it's not a death sentence, all right? It's like any other kind of infection. But just so that you don't also get it, I mean, if the person is going to the washroom, if the person is vomiting or whatever, if whatever they do, they just have to wash their hands properly before they handle food. If you are taking care of them, also wash your hands properly before they before you handle food or water. I mean, they can leave and then they should seek treatment, really. Get them to the facility and then they get treatment. It will let you know whether it's actually the typhoid or not. And once you get the treatment, you get cured. Unless you have other things that may require more detailed evaluation and treatment. So it's simple. Get them to the hospital. They get treated. They eat well. You wash your hands, and then you drink good potable water. And of course, if you have any means to get your immunity up, why not go for it? And I've told you what I readily recommend for my people. Just get it and then be up there yourself. Yes. Right. Anybody with any questions?
Yeah, there is another question on YouTube. It says, if I have typhoid and it gets treated, how long will it take for me to have it again?
All right. So if you have typhoid and it gets treated, for you to get it again, you have to go back to whatever you ate that brought it. So be careful what you eat. Now it seems like once you get typhoid, we know that it is your food or your water that got contaminated. So then if you are eating or drinking contaminated food or water, and if that's all you eat, it won't take much long. Once the antibiotics have done their job and then are out of your system, you will still get it. You get it if you are still continuing with the contaminated food. And somebody also wants to know, what food should they avoid if they have it? Avoid contaminated food. That is it. You can eat any food, and any food. You can eat your vegetables, you can eat your wache, you can eat your fufu. Just make sure that it's cleaned properly and it's handled properly. That's all. Eat anything and make sure your meal is balanced. It's very nutritious. And that's how you get the nutrients to build yourself up to fight it. All right. Just make sure your food is not contaminated.
So somebody also want to ask, can typhoid lead to any diseases?
Can it lead to any other disease?
Yeah.
So typhoid itself can have its own complications, and it can give you a lot of multisystemic. As a follow-up to your thing, chronic diseases and typhoid, yes, it can become chronic, especially if you have these stones in your gallbladder. Like I said, that thing is housed just underneath your liver. And in healthy people, you may probably not feel it. You may not even know. You won't know that you have stones in your gallbladder. Quite a number of people have stones in their gallbladder. And the germs have a predilection for this place. So they can stay there and then keep multiplying, and then you'll be shedding it into your stools or your excrement. And that's what happened with Typhoid Mary, the story I told you earlier. So then it's important, once you get scanned and then you realize that you have stones, you probably may not even have typhoid. The fact that you have stones doesn't mean you have typhoid. No, it doesn't mean that. But then once you get typhoid, it's possible that they can hide in these stones and then be giving you chronic disease. And all these things can be treated, just so you know. And like I said, if you don't treat them, the typhoid once it starts, it can lead to a lot of multi-systemic disease. It can get to your bones, it can get to your heart, it can get to your lungs, it can even get to your brain. And I mean, it has its own unwanted things. Miss Lee says she was told that they don't have to take in oily food. And I'm guessing that it also relates to the point of this gall disease. The stones, usually people who have these gallstones are sort of intolerant of oily food, all right? Because these things sort of push the gallbladder to work, and then you start having abdominal pains and symptoms. So it's not per se about the oily food, but it's because of probably the other things that it provokes. And once you have any concerns about oily food, maybe it gives you abdominal pains or it makes your eyes get yellow. I think it's an important thing to get evaluated for that. So then they can eat food that has oil. It shouldn't be a problem. But if you eat oily food and then you're having problems, maybe you should get evaluated, right? You should get evaluated.
All right, there's another question on YouTube saying, can typhoid be treated completely with herbal medicine?
All right. So to answer this question, I'm sure most of the antibiotics that we have, they are either from certain kinds of bacteria or certain kinds of microorganisms or from plants. Um, Quite a number of them are from these things. They are isolated from certain active ingredients from these things. It stands to reason that if whatever herbal medication that you are taking contains the active ingredient that can cure it, I mean, it's just possible that you can have relief of your symptoms. What I cannot vouch for is an open or blanket statement about every herbal medication. I don't know what goes into what herbal medication, and people get smart over the period. I mean, they say it's herbal, but they've bought a lot of things and put concoctions in there, and it probably may not even be good for you. So just be careful. Visit a hospital and then get tested and treated. All right. I mean, there are other herbal preparations that are properly certified. They are properly tested and properly certified. I mean, if your health practitioner recommends that for you, I mean, I have no qualms about it. But my take is get seen by a person qualified to treat it, and then get treated. All right.
Yes, so like Dr. Michael is saying, there are herbal preparations that are approved by FDA, which means they are safe for human consumption. There are others that are just sold by hearsay. Those ones are not safe for your consumption at all. Someone is asking, can surgery be taken whilst treating typhoid?
Well, yes. For me, there's nothing wrong with taking Sojivit if you are taking it and you are treating typhoid. Just make sure that you are treating your typhoid and not taking the Sojivit to treat the typhoid. Just understand that it is going to help you get better, strengthen your immune system, and then at least once your immune system is working, the drugs will work better, and then you feel much better quicker, and you can continue afterwards, really. And it's all about getting improved immunity and improved strength, getting your body built up so that you can withstand any damage that is getting to it. So yes, you can go ahead and take a go at it.
Okay, so there's a question about ulcer, but I will ask that Celine, you go to the YouTube channel. Dr. Michael gave us a whole lecture on ulcer, peptic ulcer diseases, what to avoid, how to go about it. So when you go to the YouTube channel, you get to hear everything about ulcer. Then if you have questions after that, you can put it in the chat box. We will answer you on the YouTube channel. Thank you very much. If anybody has any other question, please put it in the chat box, either on YouTube or on Zoom. We will answer you. What is the full meaning of FDA? Wow. Food and Drugs Authority, please. Food and Drugs Authority. That's the organization that they approve of what any food or any drugs that has to come through the system to make sure they are safe for human consumption. So herbal preparations, most of them on the market being sold by hearsay, are not approved by FDA. So those are not safe. All right. Okay. All right. Any other questions? Any other questions? Few seconds more to go. Any other questions, Dr. Michael? If you want, we've had a lot of topics, like I said, on the YouTube channel. Please, can children and pregnant women build their immunity with cell-gpt?
All right. So with children and pregnant women, usually we because for the children, I mean, they have good amounts of the glutathione in them, so it's not something they wholly required to get surgery with pregnant women, because of the babies they carry too, not because it's unsafe, but because the babies also are developing. We recommend that they don't use these ones. But children, they have max infuse they can use. A whole host of multivitamins that and antioxidant that can help them. It's sweet tasting, and I mean, everybody in the family can have a go at Max Infuse, because it has good amounts of vitamins and minerals and lots of antioxidants that everybody in the family can use. All right. Yeah. So GVT, maybe you hold on for them, but then you can wholly give them accent views because of what it has. All right. Do you have joint and body pain when you have typhoid? Yes, Margaret. You can have joint and body pains when you have typhoid. And just like malaria too, you can have joint and body pain. So when you have joint and body pains, it doesn't mean you have typhoid. It also doesn't mean you have malaria. It probably could be that you are just tired, all right? So fever, joint pains, body pains, constipation or diarrhea, vomiting, you are feeling cold, then you may be thinking of something infective. So then you just have to get tested and then properly evaluated, all right? So thank you very much. Thank you very much. I hope I answered your question.
Okay. Okay. Somebody. Okay. Abraham, your question has been answered. You asked about taking Celgivity while treating typhoid. Dr. Michael says yes. It helps boost your immunity. You can take it alongside your prescribed medication. It's a supplement, an organic product that can help you. Yes. And another person is asking about spine surgery. Can a product help me? John, yes, it will help you. So you can get in touch with whoever invited you or with me directly. My number is on the YouTube channel, or whoever invited you to the call, they can get it for you as well. Can antibiotics be taken along Celgivity supplements?
Right. So like I said, it's possible to continue to take your Celgivity whilst you are taking your antibiotics. But if you're having any problems, you can just space them, all right, 2 hours apart, and then you can take it. But you can still take it whilst you are treating whatever you are treating. Okay. If you want to space them, that's fair. You can space them some 2 hours apart so that everyone will be doing its own thing at its own time. There's no problem at all whilst you are treating an infection, taking surgery. There's no problem. It just helps you get stronger quicker so that you can continue your regular activities. Okay. Yeah.
All right. Thank you very much. So, like, I remember way back in medical school, our professors used to tell us that if you have typhoid, it means you have eaten human excreta. That is that's a fact. It means you have eaten human excreta. And Dr. Michael explained how that happens, how that the contamination happens, enters your food directly, indirectly, long term, and then you end up consuming it. You may be eating in a mansion, but the food was contaminated on the market and you didn't cook it well and all that. So let's try as much as possible to boost our immunity, to know what we eat our food hot, make sure we wash our hands with soap and water. I know this thing that most of us don't wash our hands with soap when we are about to eat. It's something that we need to also look at as well. Can someone help me with the recommendation of antibiotics? This one, we prefer you go to the hospital, all right? We will advise you go to the hospital to get diagnosed appropriately and then given the antibiotic to treat the typhoid. If you were talking about the recommended organic product to boost your immunity, Dr. Michael, you can put that one up again. Somebody's asking that one. But for the antibiotics, you need to go to the hospital and be prescribed the recommended antibiotic. But for the recommended organic product Dr. Michael recommended, you can get back to the one who invited you to the call. You can look out for our number on the YouTube channel and reach out. You can be helped to get this organic product to help boost your immunity. So thank you very much. If no one has any other question, I want to say a big thank you to Dr. Michael Kwapon-Nyakun, Specialist Surgeon, Kolibu Teaching Hospital, for such an amazing dose of great knowledge on typhoid and everything that we need to know about it. Thank you very much, Dr. Michael. Please help me say thank you to him for availing himself. You know, surgeons are very, very busy people, and he's a family man as well, but he's made time to share his knowledge with us. This is just to help reduce the misinformation out there. Most of us keep going to hospital to do the WIDA test. So, Dr. Michael, I have a question. I know you answered it indirectly, but I want you to be clear from the expert himself. If I go to the hospital and I do my WIDA test and it is 1 over 160 and 1 over 320, what does it mean? What should I do?
All right. So the WIDA test, I think during the thing I talked about it, the WIDA test, it's an antibody testing of sorts that is done. And for anybody who has been exposed, your WIDA titers may go up. All right. 1/20, 1/40. Yes, I mean, all these things are parameters that we use. Now, for those of us in endemic areas, the um, the literature says that, I mean, you can have a high without titer. It doesn't necessarily mean you have the infection. It's probably because you have been exposed before, and so your body produced antibodies to it. All right. So a lot of people get treated unnecessarily for it, just because the without titers went a bit high. But then certain titers very, very, very high, and depending on whatever symptoms you have, may warrant treatment. That is, and that one will depend on and whoever is seeing you. If you don't have any symptoms and your vidal is just maybe 1/100, 1/120, 1/80, somebody, I mean, you probably got exposed sometime in the past, and then you've produced the antibodies, and so when you test it, you get these antibodies showing. So it doesn't necessarily mean you have an active infection going on. So let's just be mindful about that.
Thank you.
The without test becomes becomes very important when you are showing symptoms and signs. But if you are fine and then you just think that, oh, it's been a while, I got treated for typhoid, so I should get treated again, and my withdrawal is high, it's not properly, it's not just correct. All right. So yes, let's be mindful about that.
And finally, there are people who begin to own the disease. They call it my typhoid, my typhoid. Dr. Michael, final words. What do you
have you can't own a disease just like that. Your typhoid, my typhoid has come. It's not like osteoarthritis that I say, oh, the knee pain has come. I mean, it's something that can be treated and then you can be free of it. All right. And most people get free of it. And once you are treated and you are free, it's free. I mean, you are gone. I mean, that's it. The typhoid is no longer, unless you go back to the things that brought it. You go back to the food contaminated or to the water contaminated. And I mean, that's how come you can get it. So knowing that if you have typhoid, it means you have come into contact with somebody else's excrement. I mean, I just watch what I eat. I don't want that stain on me, really. I go there, oh, he has typhoid. Everybody knows that you ate somebody else's food. I mean, I don't want to. I don't want that. So be careful what you tell yourself. You have typhoid. It presupposes you just don't watch what you are eating, all right, exactly. Or what you are drinking.
Yes. Yeah. When you say you have typhoid, your typhoid has come. It means you are eating human excreta indirectly. So don't own it. Somebody is asking, is it safe to do without test on children?
All right. So, like I said, it can be done on anybody. It's clinically okay to be done. But the accuracy and all that is what I talked about earlier. There are other tests that can be cultured. I mean, based on your child's presentation and everything, your health practitioner will determine whether it's important to do that or to do other tests or to just go straight ahead and treat. All right. So let's put that in mind. Without test, it's a name of a test.
Exactly. Without test, the name of a test it's a rapid test, antibody test. Dr. Michael said it. That's used to quickly find out if you could likely have typhoid or not. Now, what I'm doing with children, the symptoms that they present with is paramount, and they may start treatment, but they will go ahead with the cultures, the blood, the stool, the urine cultures, even bone marrow if need be, just to be sure it is typhoid for sure, while they continue treatment. So children, withdrawal is not a go-to for children, especially in the high hospitals that have the capacity. But of course, in the district and sub-district, that's what. But again, Dr. Michael made it clear that symptoms are very important. What symptoms is a person presenting with? And for children, has the person been tested for RDT, rapid diagnostic test for malaria or not? All right. So again, so that question has been answered. Thank you very much. So yes, the organic supplement is recommended are isolGPT and ATP. Those asking my DM, isolGPT and ATP is to boost your natural immunity and take care of yourself in different other ways. It detoxifies your system as well. Again, get back to your friend who sent this link to you, or take my contact from the YouTube channel. If you're on the call and you've not subscribed to our YouTube channel yet, we've had a lot of topics over the weeks that we've been doing this. We've talked about infertility in men and women. We've talked about erection, premature ejaculation, prostate enlargement. We've talked about liposuction, yes. We talked also about addiction. We talked about nutrition. We talked about ulcer. Dr. Michael talked to us about peptic ulcer disease. It's all on the YouTube channel. So just subscribe and stay tuned and go and consume the content on the YouTube channel. Share with your friends as well so that they also get informed. Once again, in the absence of any other question, Dr. Michael, I want to say a big thank you to you for availing yourself to educate us freely. And thank you all very much as well, our guests on YouTube and on Zoom, for making your time, and of course for all the questions and all the insights that has been shared on this call. Until next week, I am glad to have been your host. It's been a pleasing pleasure serving you all.